Hello everyone, good day. So we are going to answer these following questions. So first is, what is schizophrenia? Schizophrenia is a chronic mental health disorder characterized by disruptions in thought processes, perceptions, emotional responsiveness, and social interactions. It involves psychosis, where individuals may experience hallucinations, delusions, disorganized speech, and abnormal motor behavior. So there are different types of schizophrenia, and we're going to tackle its signs and symptoms and its nursing interventions. So first is the disorganized schizophrenia. This type of schizophrenia is characterized by disorganized speech and thought, along with flat or inappropriate affect. So patients with schizophrenia or disorganized schizophrenia may exhibit bizarre behavior and have difficulty maintaining personal hygiene. Next is catatonic schizophrenia. It is a features of catatonia, which includes immobility, rigidity, or excessive and purposeless movement. So patient may also exhibit mutism or echolalia. So next is paranoid schizophrenia. It is dominated by delusions and hallucinations, often with themes of persecution or grandeur. Disorganized speech and behavior are less prominent. Next is residual schizophrenia. It is characterized by a past history of at least one psychotic episode, but currently lacks of prominent positive symptoms like hallucinations or delusions. Next type is undifferentiated schizophrenia. It is a mixed symptom that do not clearly fit into the other categories, lacking the prominence of delusions, hallucinations, disorganized speech, or catatonia. So for the treatment of all these types of schizophrenia is involves antipsychotic medication, psychotherapy, and social support. The focus is on managing symptoms and improving quality of life. While the types are no longer formally classified, treatment may be tailored based on the predominant symptoms. So for the nursing interventions of the schizophrenia is we should focus on establishing trust to the patient, managing symptoms, promoting medication adherence, and enhancing daily functioning. Um, there are also specific interventions that includes reality orientation, presenting reality to the patient for hallucinations, and promoting social skills and ensuring a safe environment. Next is we're going to describe the maladaptive patterns of behavior. So first is the schizophreniform disorder. It is a short-term version of a schizophrenia, lasting less than 6 months. So some of the symptoms of these disorders include similar to schizophrenia but with a shorter duration. Treatment includes antipsychotics and psychotherapy. For the nursing intervention, similar also to the schizophrenia, we're going to focus on the symptoms and management and support, and also presenting reality. Next is the schizoaffective disorder. So this is a combine of symptoms of schizophrenia with a major mood disorder, depression, or mania. Some symptoms include hallucinations, delusions, and mood disturbances. For the treatment, antipsychotic medications and mood stabilizer. And for the nursing intervention, we should manage both psychotic and mood symptoms, and we should promote medication adherence. Next is the delusional disorder. So the delusional disorder is characterized by persistent delusions without the full symptoms or complex of schizophrenia. Some symptoms of this is dominant delusions, often non-bizarre. So for the treatment, antipsychotics and psychotherapy. And for the nursing intervention, we should focus on reality testing and coping strategies. Next is the brief psychotic disorder. It is a short-term psychotic episodes lasting less than a month. So some symptoms is include sudden onset of hallucinations and delusions. So treatment include antipsychotics and supportive therapy. So for the nursing intervention, we should um, manage crisis management and support. Next is the shared psychotic disorder. It is a condition where a person develops delusions influenced by someone else with delusions. You know, silent symptoms include adopted delusions from another person. So, for treatment, psychotherapy, and possibly antipsychotics. So, for the nursing intervention, we should focus on separating the individual from the delusional influence. And then next is we're going to describe the fetal alcohol syndrome. A fetal alcohol syndrome is a condition resulting from prenatal alcohol exposure, leading to physical or cognitive and behavioral problems. So, silent symptoms includes growth deficiencies, facial abnormalities, and developmental delays. For the treatment, we have the supportive care and educational interventions, and also the behavioral therapy. For the nursing intervention, we should focus on the developmental support and family education. Then next is the ADHD or attention deficit hyperactivity disorder. It is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity. Signs and symptoms include difficulty focusing and excessive activity and impulsive behavior, especially commonly for the younger children. And then the treatment includes medications like stimulants and behavioral therapy. For the nursing interventions, we should have a structured environment for this type of this for this disorder, and then behavioral reinforcement and medication management. Then next is the ASD or autism spectrum disorder. It is a neurodevelopmental disorder affecting communication, social interaction, and behavior. So there are types of ASD, the classic autism, the Asperger's syndrome, and pervasive developmental disorder. Um, Signs and symptoms include social withdrawal, communication difficulties, and repetitive behaviors. For the treatment, we have the behavioral therapies like ABA, and then speech therapy and occupational therapy. For the nursing interventions, we should focus on communication support, behavioral management, and family education. So next is what is mental retardation? So a mental retardation is now commonly referred to as a intellectual disability. So it is involves significant limitations in intellectual functioning and adaptive behaviors. It is characterized by an IQ below 70 and difficulties in social and practical skills. So there are different levels of mental retardation. First is the mild or the moron. It can learn academic skills up to approximately sixth grade level by adulthood. Then the moderate one. It can learn simple communication and basic self-care skills. Then the third is severe, which is called as idiot, and it is limited ability to communicate and requires significant support. And the fourth one is the profound. It is minimal ability to communicate or care for oneself. So treatment focuses on supportive care, education, and behavior interventions tailored to the individual's level of functioning. For the nursing interventions include providing supportive care, promoting independence, and educating families on how to manage daily needs. So next is delirium and dementia. We are going to differentiate these two. So first is the delirium. It is an acute reversible condition characterized by confusion, altered consciousness or level of consciousness, and disorganized thinking. While the dementia, on the other hand, is a chronic progressive condition involving memory loss and cognitive decline. Next is Alzheimer's disease. What is the Alzheimer's disease? It is a progressive neurological disorder leading to the degeneration and death of brain cells, resulting in a continuous decline in thinking, behavioral, and social skills. So, early symptoms include memory loss, confusion, and difficulty with communication. As it progresses, patients may experience disorientation, mood changes, and loss of motor skills. Treatment involves medications to manage symptoms such as cholinesterase inhibitors and supportive care. For the nursing interventions, we should focus on providing a safe environment and promoting independence, and especially we're going to manage behavioral symptoms in supporting caregivers. Then we're going to describe the different um, eating disorders. First is the pica. It is a eating it is a type of eating disorder where a person eats non-food items. So signs and symptoms include consumption of non-food substances. For the treatment, behavioral therapy and nutritional support, and for the nursing intervention, we're going to monitor for ingestion of harmful substances. Next is rumination disorder. It is characterized by repeated regurgitation of food. Signs and symptoms include frequent vomiting after eating. So it's not the same with anorexia or next is the rumination disorder. It is characterized by repeated regurgitation of food. Signs and symptoms include frequent vomiting after eating and yeah, and treatment for the treatment, behavioral therapy, and dietary changes. For the nursing intervention, we should focus on dietary management and reducing regurgitation behaviors. Next is anorexia nervosa. It is characterized by restrictive eating leading to significant weight loss. So some of the symptoms include severe weight loss, fear of gaining weight. For treatment, nutritional support, and psychotherapy. For the nursing intervention, we should monitor weight, promote healthy eating habits. Next is the bulimia nervosa. It is characterized by episodes of binge eating followed by purging. Signs and symptoms include frequent binge purge cycles. For treatment, psychotherapy and medications may help. For the nursing intervention, we should focus on reducing binge purge behaviors. Next is binge eating disorder. It is a recurrent episodes of eating large amounts of food without purging. Signs and symptoms include frequent binge eating and the treatment, behavioral therapy, and medications could help. For the nursing interventions, we should promote healthy eating habits and reduce binge eating behavior. And next is the different psychosexual disorder. First is gender identity disorder. So gender identity disorder is a distress. due to a mismatch between gender identity and biological sex. So, silent symptoms include feeling of being in the wrong body, and for treatment, hormone therapy, surgery, and psychotherapy. Nursing interventions include supporting care and education. Next is the hypoactive sexual desire. It is a persistently low sexual desire. Signs and symptoms include lack of interest in sex. For treatment, counseling, medications, um, yeah. Then for the nursing interventions, we should focus on communication and intimacy support. Next psychosexual disorder is sexual aversion disorder. It is an avoidance of sexual activity due to anxiety or fear. Silent symptoms, avoidance of sexual contact, and psychotherapy is the treatment of this disorder. Next is for the nurse intervention, we should have a supportive counseling. Next is dyspareunia. Next is dyspareunia. It is characterized by painful sexual intercourse. Silent symptoms include pain during sex. For treatment, medical treatment and counseling could help. And then for the nursing intervention, we should focus on pain management and sexual health education. Next is vaginismus. It is an involuntary muscle spasms preventing vaginal penetration. Some symptoms include difficulty with penetration. And for the treatment, physical therapy and counseling. And for the nursing interventions, supportive care and education on relaxation techniques. Next is premature ejaculation. It is described as a involuntary ejaculation shortly after penetration. Signs and symptoms include early ejaculation. For the treatment, behavioral therapy and medications. For the nursing interventions, we should focus on behavioral techniques to delay ejaculation. Next is the female orgasmic dysfunction. It is the difficulty achieving orgasm. Signs and symptoms include inability to reach orgasms, and for the treatment, counseling and medications. For the nursing intervention, we should have a supportive counseling and education on sexual health. Next is the male orgasmic dysfunction. It is a difficulty achieving orgasm in male. And signs and symptoms include inability to reach orgasm. For the treatment, counseling and medications. And for the nursing interventions, we should focus on communication and sexual health support. Next is the erectile dysfunction. It is characterized by inability to achieve or maintain an erection. Signs and symptoms include next is erectile dysfunction. It is characterized or it is an inability to achieve or maintain an erection. Signs and symptoms include difficulty with erections and for the treatment, medications, and counseling. For the nursing intervention, we should have supportive care and education on sexual health. Next is sexual addiction. It is a compulsive engagement in sexual behaviors despite negative consequences. Signs and symptoms include excessive sexual behavior and for treatment, counseling, and support groups. For the nursing intervention, we should focus on behavioral change and support. Next is exhibitionism. It is exposing oneself to others for sexual gratification. Signs and symptoms includes engaging in exhibitionistic behaviors, and for the treatment, counseling and therapy. For the nursing interventions, we should have a supportive care and legal awareness. Next is fetishism. It is characterized by sexual arousal from non-living objects or specific body parts. For example, food fetish, like that. And for the signs and symptoms, sexual interest in non-human objects. For treatment, counseling, and for the nursing interventions, we should have a supportive counseling. Next is futurism. It is characterized by touching or rubbing against others for sexual gratification. Signs and symptoms include engaging in futuristic behaviors, and for treatment, counseling, and therapy. For the nursing intervention, we should focus on legal awareness and behavioral change. Next is pedophilia. It is described as sexual attraction to prepubescent children. And signs and symptoms, sexual interest in children, and for treatment, counseling, and therapy. For the nursing interventions, supportive care with emphasis on legal and ethical considerations. Next is the sexual masochism. It is deriving from sexual pleasure from being humiliated, humiliated or hurt. Signs and symptoms include engaging in masochistic behaviors. For treatment, include counseling. For the nursing interventions, we should have a supportive counseling and safety education. Next is sexual sadism. It is deriving a sexual pleasure from inflicting pain, or the opposite of a engaging in masochistic or a masochism. Um, Signs and symptoms include engaging in sadistic behaviors. For the treatment, include counseling and therapy. For the nursing intervention, should focus on legal awareness and behavioral change. Next is transvestic fetishism. It is characterized by a sexual arousal from dressing in clothes of the opposite sex. Signs and symptoms include sexual interest in cross-dressing, and for treatment includes counseling. For the nursing intervention, um, includes supportive counseling. Next is voyeurism. It is deriving a sexual pleasure from watching others without their consent. Signs and symptoms include engaging in voyeuristic behaviors. Treatment includes counseling and therapy. For the nursing intervention, we should focus on legal awareness and behavioral change. Next is zoophilia. It is characterized by a sexual attraction to animals. Signs and symptoms include engaging in zoophilic behaviors, and for treatment, counseling and therapy. For the nursing interventions include supportive care with emphasis on legal and ethical considerations. Next is necrophilia. It is a sexual attraction to corpses. Signs and symptoms includes engaging in necrophilic behaviors, and for treatment includes counseling and therapy. For the nursing intervention, we should focus on legal awareness and ethical considerations. Next is coprophilia. It is a sexual arousal from feces. Signs and symptoms include engaging in coprophilic behaviors. For the treatment, includes counseling and for the nursing interventions, supportive counseling, and hygiene education. Next is urophilia. It is a sexual arousal from urine. Signs and symptoms include patient engaging in urophilic behaviors. For the treatment, includes counseling, and for the nursing intervention, we should focus on hygiene and supportive care. Next is partialism. It is characterized by a sexual arousal from specific body parts. Signs and symptoms include um, sexual interest in a specific body parts, and for treatment includes counseling, and for the nursing interventions um, includes supportive counseling. Next is telephone scatologia. It is making obscene phone calls for sexual gratifications. Signs and symptoms include engaging in scatological behaviors, and for the treatment, counseling and therapy. For the nursing intervention, we should focus on legal awareness on behavioral change.